In today's video, we will discuss everything you need to know about COOMBS test. Here we will find out what is COOMBS test, principle of COOMBS test, what is COOMBS serum and how is it prepared, difference between complete versus incomplete antibodies, what is direct COOMBS test, what is the procedure of DCT step by step, what is indirect COOMBS test, how ICT is done. And what is the difference between direct COOMBS test and indirect COOMBS test? Practical use of DCT and ICT in different disease conditions. And when to do ICT in a high-risk mother. So let's get started. What is COOMBS test? In simple words, it is an antigen and antibody reaction test which is used to detect presence of anti-RBC antibodies by using COOMBS reagent. If it detects antibodies bound to RBC surface, it is called direct COOMBS test or DCT. If it detects unbound antibody in serum, then it is called indirect COOMBS test or ICT. So basically COOMBS test is an immunology lab procedure. Hence, COOMBS test is also called as antiglobulin test. DCT is also called as direct antiglobulin test or DAT. And ICT is also called as indirect antiglobulin test or IAT. What are anti-RBC antibodies? Human RBC has various antigens on its surface. For example, A antigen, B antigen, RHC antigen, RHD antigen and many more. Sometimes specific antibodies are produced against certain RBC antigens. These binds to particular antigens. These anti-RBC antibodies are capable of causing immune-mediated hemolysis or immune hemolytic anemia. COOMBS test helps to diagnose this immune hemolytic anemia. Facts about COOMBS reagent, COOMBS serum or AHG. COOMBS serum was discovered by COOMBS et al. In the year 1945. This serum is also called antiglobulin serum or AHG, anti-human globulin. What is COOMBS serum and how it is prepared? COOMBS et al. Observed that when anti-RBC antibody from human is extracted and injected into an animal, for example rabbit, it produces antiglobulin against anti-RBC antibody. Serum of that animal is then taken out, which is then called COOMBS serum or COOMBS reagent. So COOMBS serum is nothing but a serum rich in anti-human globulin. Concept of complete and incomplete antibody. Incomplete antibody. In year 1945, an immunologist, Robin COOMBS, noticed that sometimes red cell coated with antibodies or complements do not agglutinate directly when centrifuged. These are called incomplete antibodies. These antibodies cannot cross-link, hence no agglutination. Complete antibody. For agglutination to occur in immunoglobulin and complement sensitized RBCs, an additional antibody is required, which will react with Fc portion of anti-RBC antibody or with C3b or C3d component of complement. These are called complete antibodies. These antibodies bridge between incomplete antibodies bound to RBC, causing agglutination. Principle of COOMBS test. When COOMBS reagent containing anti-HUIG, which is a complete antibody, is added to RBCs coated with anti-RBC antibodies, which is incomplete antibody, there occurs agglutination. Types of COOMBS test. It has two variants, direct COOMBS test or DCT and indirect COOMBS test or ICT. Direct COOMBS test. What is DCT? Step-by-step method how to do DCT. In which diseases or conditions it comes positive. What is DCT or direct COOMBS test? DCT detects antibodies or complements attached to RBC using COOMBS reagent. DCT procedure. 2 ml of EDTA sample is taken. It is brought to 37 degrees Celsius temperature. It is then centrifuged at 1000 rpm per 1 minute. RBC precipitate is taken in small amount from this, which is then washed with normal saline 3 to 4 times. This is to remove free antibodies or complements that may bind to COOMBS reagent and interfere in reaction. 2 to 5% of RBC suspension is then prepared in normal saline. 1 drop of washed and suspended RBC is taken. On the other side, COOMBS reagent is brought to 37 degrees Celsius temperature. 2 drops of COOMBS reagent is taken. Both are mixed. The mixture is then incubated at 37 degrees Celsius for 30 minutes. Incubation is optional in DCT as agglutination occurs even without incubation. It is then centrifuged at 1000 rpm per 1 minute. Next, it is examined for agglutination under microscope. Presence of agglutination indicates positive reaction. Also can run a control test tube simultaneously and compare with it. Fun fact: for antigen and antibody reaction to take place, ratio and concentration of antigen and antibody should be appropriate. If antigen is in excess or antibody is in excess, then there will be no reaction. Hence, concentration and proportion of blood sample and COOMBS reagent are crucial here. So, to sum up DCT method, it is an one-step process where pre-washed RBCs, which are antibody and complement coated, are mixed with COOMBS reagent. Agglutination is a positive reaction. Practical use of DCT. It is used to diagnose mostly autoimmune and alloimmune hemolytic anemia. Some other diseases or conditions where DCT may come positive are CLL or chronic lymphocytic leukemia, syphilis, lupus, infectious mononucleosis, mycoplasma infection, etc. Indirect COOMBS test. What is ICT? Step by step, how to do ICT? In which diseases ICT comes positive? What is ICT or indirect COOMBS test? ICT detects free-floating antibodies in patient serum using COOMBS reagent. ICT procedure. Patient's clotted blood is taken a sample. From this, 2 drops of serum is taken which is anti-RBC antibody, to which 1 drop of 2 to 5% suspension of RBC with known antigenicity is added. It is then incubated at 37 degrees Celsius for 30 minutes. Maintaining appropriate temperature is crucial for antigen and antibody reaction. Hence, RBC gets sensitized and gets coated with anti-RBC antibody from patient serum. Till this point, it is step 1 of ICT. Step 2 of ICT is similar to single step of DCT. Incubated sample is centrifuged at 1000 rpm per minute, from which RBC sediments in a small amount is taken. It is then washed 3 to 4 times with normal saline. From this, 2 to 5% of RBC suspension in normal saline is prepared. 1 drop of washed and suspended RBC is extracted. 2 drops of COOMBS reagent is taken at 37 degrees Celsius and both are mixed. The mixture is then incubated at 37 degrees Celsius for 30 minutes. It is centrifuged at 1000 rpm per minute. Next, it's examined under microscope for agglutination. Also can use test tube alongside autocontrol, positive control and negative control tubes for comparison and interpretation of result. Presence of agglutination indicates positive reaction. To sum up ICT method, it is a two-step process where in the first step serum containing anti-RBC antibody is mixed and incubated with RBC of known antigenicity so that it gets antibody coated. In second step, COOMBS reagent is added and agglutination indicates a positive reaction. Practical implication of ICT. ICT is done pre-transfusion for blood grouping and RH typing and cross-matching, also alloimmune hemolytic anemia. ICT is also done antenatally in high-risk mother in case of suspected hemolytic disease of newborn. Difference between direct COOMBS test and indirect COOMBS test. Here are 6 points. DCT detects antibodies or complements attached to RBC surface using COOMBS reagent. ICT detects free anti-RBC antibody in serum of a person using COOMBS reagent. DCT detects bound antibody. ICT detects unbound antibody. DCT can detect complement. ICT cannot detect complement. Sample taken for DCT is RBC, whereas sample taken for ICT is serum. DCT is an one-step process. In this step, pre-wash sensitized RBC is mixed with COOMBS reagent. ICT is a two-step process. In first step, patient serum containing antibody is mixed with RBC of known antigenicity. Then this antibody-coated RBC is mixed with COOMBS reagent. Diseases that are diagnosed using DCT are autoimmune disease like autoimmune hemolytic anemia, drug-induced hemolytic anemia. Alloimmune diseases like hemolytic disease of newborn, transfusion reaction. ICT is used in case of pre-transfusion blood grouping and RH typing cross-matching. Also in antenatal detection of HDN, for example RH incompatibility. Role of COOMBS test in HDN or HDFN. In HDN or HDF, that is hemolytic disease of fetus and newborn, mother produces antibodies against RBC surface antigen of fetus or baby that crosses placenta and cause hemolysis in baby. For example, RH incompatibility, ABO incompatibility, minor blood group incompatibility. Role of DCT in HDN. DCT is done in newborn in case of suspected HDN that detects antibodies coated newborn RBC. How DCT is done? It is done by one-step method. Take for example RH incompatibility. Baby's blood is taken which is RH positive RBCs coated with anti-D antibody of mother. It is then mixed with COOMBS reagent containing anti-HUIG. If clotting, then DCT is positive. ICT is done in mother's serum to detect antibody to fetal RBC antigens. How ICT is done? It is done by two-step method. For example, in RH disease, in first step, mother's serum with anti-D antibody is taken, which is mixed with RH positive donor RBC, preferably O positive RBC with RHD antigen. Antibody will then attach and coat RBCs. In second step, antibody coated RBC is then washed, suspended and mixed with COOMBS serum, which is anti-HUIG. If clotting, then ICT is positive. When to do ICT test in high-risk RH incompatible mother? It is done in RH negative pregnant mother at 12 weeks of gestation. If ICT is positive, mother should be further supervised and followed up in center specialized for fetal medicine, which is well equipped to tackle such pregnancy. If ICT is negative, then repeat ICT. For primary, repeat at 28 week and then 36 week of gestation. For multipara women, repeat at 24 week and then monthly. Today's MCQ. For pre-transfusion, blood grouping and cross-matching, which test is done? DCT or direct COOMBS test? ICT or indirect COOMBS test? Both? None. Leave your answer in comment box below. Thank you for watching. Do like, comment and subscribe. Disclaimer. This is an educational video. It is not meant for diagnosis and treatment. Consult your physician for medical advice.